all that extra time, you probably ate it up trying to sleep in because you're so tired today because of the time change. So yesterday, we jumped ahead for daylight savings time. Joining us now with some of the negative effects that our bodies are going to feel today, Dr. Chaffoo. Good morning.
Good morning.
Whose idea is, why do we do this year after year after year if it's hurting us?
That's a very good point. It's something to do possibly with the fact that, you know, with these time changes, we don't want kids outside in the dark with school buses. It may have something to do with farmers, but there are some changes that occur that are not necessarily have positive health impacts.
Okay, let's talk about this. Why is this so hard? It's just an hour, but it's so hard on our bodies.
Well, that's a great question. And the reason, Shally, is because many Americans were already sleep deprived. We're probably not getting enough sleep as it is. So when you add another 40 minutes on someone that's sleep deprived, it can be enough to push things over the edge.
Okay, we were talking about this last week, that today is a day where heart attacks go up, there's more crashes on the road.
Yes.
So you're gonna feel groggy. How does your grogginess affect your heart today?
So it's interesting, Shally, they've looked at, researchers have shown that actually there is, as you said, a spiked increase in heart attacks on the Monday following changes in the time zone. And what we think might be happening is that with our circadian rhythm, there is a protective effect on the heart. When we sleep, our blood pressure is lowered. And so perhaps it's not saying that it causes one to have a heart attack. In those people that are at higher risk, there is a spike or an increase. So researchers are theorizing that perhaps with this change in the time, our circadian rhythm is disrupted and we're not having that protective effect on lowering our blood pressure. So people that are at high risk anyway probably would have at some point developed a heart attack or a stroke, but they just seem to have it occur more likely earlier. And that may be a factor
that
involved.
makes sense. Probably if you're around your coworkers today or your family, somebody's not going to be in a good mood. You should just cut them some slack today, right? Why?
Well, the reason being that we know that with sleep deprivation, there is an effect on the amygdala, which is the emotional center in the brain.
Okay.
And we're seeing that these hormonal changes that occur, there is a normal awake cycle and a sleep cycle, and there are hormonal changes. And so this can definitely affect our irritability, our ability to concentrate, our mood.
Even our appetite will be affected today.
Absolutely. Researchers have definitively shown that when you're sleep deprived, Shally, you're more likely to be producing a hormone called ghrelin, which is what makes us all hungry and makes us want to eat. So that hormone goes up. And the hormone that's responsible for us being full, our brains telling us stop eating, leptin, is diminished. So there are some physiological changes. People tend to make poor choices, overeating or eating the wrong things, eating too much.
And then will this balance out? What, 7 to 10 days we'll be back?
About 7 to 10 days. So hang in there.
For 1 hour. Who's in charge of this? Dr. Chaffoo, thank you for being here. They should watch this segment. Raul?